Welcome to the podcast, The Patient's Voice. Does it matter? This is a place where your voice will always matter to me. Healthcare is complicated, so I wanted to create a space where we will discuss tips, hot topics, provide resources, have guest speakers who are experts in the healthcare industry, or real patients sharing their patient experience in hopes to help you navigate any healthcare setting. I want to focus on you, the patient, and discuss issues that matter to you in an open and transparent way. I'm your host, Krista Hughes, the founder and CEO of Hughes Advocacy, in which I am a board-certified patient advocate. I have a passion for patients. Let's be the change together. Welcome back, friends. Today, we're going to dive into a topic that's often misunderstood, and that's the difference between palliative and hospice care. You might have heard these terms before, and maybe you thought they were the same thing. It's very common to confuse them, but palliative care and hospice are actually two distinct approaches in healthcare. They both focus on comfort and quality of life, but they come into play at different stages of illness and have some key differences. So let's unpack this. So as always, I'll start the show with a "What would you do" segment. Then we will transition into "Let's talk about it." And finally, wrap up the show where I provide you tips and how to make your voice matter in this situation. So let's start with the "What would you do?" Imagine being a caretaker for your loved one, and they've been at a skilled nursing facility with multiple health issues. They're preparing to discharge your loved one back home. And you're advised by them to put your loved one on hospice. Your loved one does not have a terminal diagnosis, and they explain that hospice has changed, and if you put them on hospice, they would help pay for your medical needs like bed, equipment, etc., to save you money. What would you do? So let's talk about it. Let's start with palliative care. Palliative care is a specialized medical care that's focused on providing relief from the symptoms and stress of a serious illness. The goal is to improve the quality of life for both the patient and their family. It's not just for people at the end of life, which is a big misconception. Palliative care can be provided at any stage of a serious illness, whether it's cancer, heart disease, lung disease, or even neurological conditions like Parkinson's or Alzheimer's. Importantly here is you don't have to stop seeking curative treatment while receiving palliative care. You can continue treatments aimed at curing or controlling the illness while also getting support to manage pain, fatigue, nausea, or emotional distress. A team of specialists usually delivers palliative care. This can include doctors, nurses, social workers, and sometimes spiritual advisors, all working together to provide a more holistic care, physically, emotionally, and spiritually. So it's more than just treating symptoms. It's all about improving the overall well-being of the person. So here's an example of palliative care. A patient develops anemia while being treated for breast cancer. So a palliative care specialist suggested that she get a blood transfusion to manage the anemia and relieve some of the fatigue she was experiencing. Controlling her symptoms helped this patient to continue her curative chemotherapy. Treating her anemia is part of palliative care per the NIH. Again, I want you to really listen to this. They were able to continue to receive the curative care of chemo. This is the difference. On hospice, you no longer receive curative care. Now let's talk about hospice care. Hospice is actually a type of palliative care, but it's specifically for people who are nearing the end of their life, typically with a prognosis of 6 months or less to live. And at this point, the focus shifts away from curative treatments and instead just recognizes your priority for comfort care. Hospice care is usually recommended when treatment is no longer controlling the illness or the patient has chosen to stop treatments like chemotherapy or surgeries. The aim is to ensure that the person is as comfortable as possible, free from pain and distress in their final months, weeks, or days. A common misconception is that hospice means you're just giving up, but that's not the case at all. It's about helping patients and families make the most of the time that's remaining, offering emotional, physical, and spiritual support. Hospice care is usually provided at home, but it can also be delivered in a hospice center, in a hospital, or in a long-term care facility. Hospice teams often include nurses, doctors, social workers, counselors, and trained volunteers who visit regularly and are available around the clock for support. So here's an example of hospice care. Choosing hospice does not have to be a permanent decision. For example, there was a patient that was in their 80s when she learned that her kidneys were failing. She thought she had lived a long, good life, and she didn't want to go through dialysis. So she began hospice care. She wanted to stop the curative care of dialysis. But a week later, she learned that her granddaughter was pregnant. So after talking with the family, she changed her mind about using hospice care and left hospice to begin dialysis, hoping to one day get to hold her first great-grandchild. Shortly after the baby was born, the doctors told her her blood pressure was starting to get too low. At that point, she decided to re-enroll in hospice per the NIH. So let's recap. The main difference between palliative and hospice care is the stage of illness at which they're provided and the goals of your care. Palliative care can be provided at any point during your serious illness alongside curative treatment. It's about improving your quality of life by managing symptoms and addressing the emotional, social, and spiritual needs of your loved ones. Hospice care is reserved for those who are nearing the end of their life and decided to stop curative treatments. The focus here is solely on comfort, not on curing the illness. In both palliative and hospice care, the patient and their family are at the center of decision-making. Please do not forget that. You are at the center. This is all what your wishes are, because the goal in both cases is to enhance your loved one's quality of life, reducing their suffering, and provide support that goes just beyond the physical aspects of care. And it's also important to mention that assessing either palliative care or hospice care, it doesn't have to be a difficult decision. There's services that are designed to support you and your loved ones during tough times. It's to make your journey of your illness more manageable. And if one of your loved ones is dealing with this, it's worth talking to your healthcare provider or a patient advocate to see what options might be available. So now we've come to the final segment where we talk about tips on what to do or how to make your voice matter. Now, remember the scenario at the beginning of the podcast with the patient who was told to be put on the hospice and it would help save money? And this patient didn't have a terminal illness. When this family put their loved one on hospice, they stopped all curative care and life-saving medications, and they weren't even allowed to be taken to the ER for life-saving measures. Hospice is designed to make you comfortable at the end of life. This patient actually took the advice of the hospice nurse over mine. And again, this patient did not need hospice. Reason I'm talking about this and letting you know the difference, and I keep bringing up curative care, people just don't know that they stop certain things in hospice. And I want you to know that there are scammers are getting beneficiaries to agree to hospice care, even though they do not qualify for the benefit, which is disgusting and gross. And that's called hospice fraud. And hospice fraud occurs when Part A is falsely billed for any level of hospice care or service. We had to address this issue of fraud and have the family member removed, which was a lengthy process. Now, remember earlier I was talking about hospice, you could come on it and you can come off of it. That's allowed. But to scam and fraudulently tell patients to get on hospice, it'll save you money, that is fraud. And it ends up hurting your family members, because if they're not at their end of their life and you're taking them off these medications, these curative medications, that causes harm to your loved ones. So please understand each type of care. And if you don't know what to do, reach out to me. I work nationwide with patients, and this is happening way too frequently. That brings us to the end of this episode. I hope this topic was beneficial to you. Thanks for listening. And until next time, take care of yourselves and each other. As always, your voice will always matter to me. And make sure you check out the resources in the show notes. Anything I've talked about will be added in there. I also have some questions, a questionnaire for you to answer if there's topics that you want me to discuss that I have not discussed. And if you enjoyed the show, make sure you follow, rate, and review me on Apple Podcasts, Spotify, Google Podcast, and reach out to me if you want to talk to me privately about any advocacy needs and helping your loved ones navigate the healthcare system. Until next time, this is Krista Hughes. And don't forget, I have a passion for patients. Let's be the change together.